This has really brought the Republican Party together. As much as we've come up with a really incredible health care plan, as far as I'm concerned, your premiums, they're going to start to come down. We're going to get this passed through the Senate. I feel so confident.
Well, first of all, the House bill is not going to come before us. The Senate is starting from scratch. We're going to draft our own bill, and I'm convinced that we're going to take the time to do it right. Speaker Ryan today said that he hoped that the Senate would improve the House bill. I think we will do so, and that we will come up with a whole new, fresh approach.
You can cut premiums, but it has to pass, the Kimmel test. Jimmy talked about his son being rushed over to have surgery. Now, I take that as a metaphor. Is your policy adequate? Of course you can cut premiums if you do what sometimes happened under Obamacare. People got a so-called skinny policy. We need to have something which is cheaper than an Obamacare policy, but still gives adequate coverage, so that if somebody has a crisis, they have the coverage.
I think what's happening is not dead on arrival, not taking the House bill and bringing it immediately to the floor, but taking what the House was able to do, looking at that carefully, and coming up with what the Senate thinks the Senate can do. This is the way legislation used to be passed. There'd be a House bill, there'd be a Senate bill, then you'd get together the conferees who understood by that time the intricacies of what they're doing and come up with a bill that can go to the president's desk, and I hope that's what we do here.
This process will not be quick or simple or easy, but it must be done. It's the least members in both parties owe to the countless Americans who continue to suffer under Obamacare and the countless more who will be hurt if we don't act.